This is my lecture on secondary prevention of cancer, which really is cancer screening. By the end of this lecture, you should be able to list the 3 cancers that have recommended screening guidelines from the U.S. Preventive Services Task Force. These cancers are breast, cervical, and colorectal/colon cancer. You should also be able to discuss the screening guidelines and the nursing considerations for mammogram, pap smear, and colonoscopy. Correction on prostate cancer screening from the textbook. That is no longer true. As of now, there is no standard screening for prostate cancer. This becomes an individual decision. Please know, though, that the risk is high for an African American male with a family history of prostate cancer. Mammogram is the mode of choice for breast cancer screening. Mammogram starts at the age of 40. And how often? Mammogram is annual until age 55. And then the woman may switch to every 2 years after age 55. There is no special preparation for a mammogram except to avoid deodorant and talc powder. Pap smear is the screening for cervical cancer, and this is initiated at age 21 or within 3 years of initiating sex. How often should pap smear be done? Every 3 years for women ages 21 to 29, and every 5 years for women ages 30 to 65. But this must be done with an HPV test. Special prep for pap smear. You should instruct the patient to not do the following 24 hours prior to the pap smear. Douching should never be done anyway. No sexual intercourse 24 hours prior to the pap smear, and do not use tampons. You should also avoid scheduling the pap smear while one is having a period or menstruating. Colon cancer. When should men and women start screening for colon cancer? Starting the age of 50 until 75. How is colon cancer screened? Colonoscopy and sigmoidoscopy. How often? If colonoscopy is utilized, it's every 10 years. But if it's sigmoidoscopy, this is done every 5 years or every 10 years if fecal immunochemical test is done every year. Because your textbook is not updated, I used CDC as my reference. What are the nursing implications for colonoscopy? In other words, how should you prepare your patient for colonoscopy? So, clear liquid diet 24 hours prior to the test. Laxatives 24 hours prior to the test. NPO after midnight, and you should instruct your patient to have a driver after colonoscopy. In other words, the patient cannot drive himself from the clinic or facility to his residence. The patient should also inform the doctor uh, regarding his medications, especially the anticoagulants. So please know the screening guidelines. And I repeat, prostate screening is no longer routinely recommended. And for prostate screening, decision to screen is an individual one. So how many are there cancers for regular screening? There are only three. You don't see prostate there. You don't see skin cancer screening there. You only see breast, cervix, and colon. Even though prostate and skin cancer screening are done, they are not recommended as routine for the general population. The U.S. Preventive Services Task Force is the agency that is primarily responsible for giving recommendations for cancer screening. What they say is important because they review the evidence in a whole lot of scientific literature, and their recommendations largely, if not fully, determines insurance coverage. So that is the US Preventive Services Task Force. And the three cancers are breast, cervix, and colon. This ends my lecture on cancer screening. Excluded from the exam are all the rest. So breast, cervical, and colon. That's all you're going to be tested on as far as cancer screening is concerned. Thank you.